But first, more than 86 million Americans are living with pain right now. They're desperate for relief. Our next guest, Ashley, is no exception.
I had a baby 5 months ago, and I wanted to get back into shape. I love running, so I bought a pair of running shoes and got back out on the road. And after running about 3 times, I really injured my foot. I couldn't walk, I couldn't go upstairs, and I definitely couldn't run. To relieve the pain, I tried icing, Epsom salt, ibuprofen. I've tried everything, and nothing seems to work. Doctors, can you help?
I'm here with sports medicine specialist Dr. Bradley Frederick, as well as Ashley. We're going to profile a cool new laser that you've been getting treatments for your problems. So tell us about this cool laser.
Well, Travis, this laser happens to be the world's most powerful therapeutic laser.
What's so great about this laser as compared to other lasers? And I know we got a cool prop to talk about it too.
Right. First of all, it has a computer control system that allows us to put that 3,000 watts of power in very slowly so that we don't do any damage to any tissues. And that also gives us that 5 inches of penetration. The average laser probably never makes it through the dermis, which means that if we've got our little jello model here and we come down, if it's a good laser, it might get to where we've got the yellow here. And if we go into the green, maybe some high-powered laser might be able to get a little bit, probably not, and we get all the way through into the red. Now, what this means is that when people have deep tissue injuries, like lower back problems, the other lasers, they don't get to it. They just get to the surface. And so the efficacy is not so good. It's fine if you want to do a wrist or a finger, but if you really got to get deep in, if you can't hit the tissue with the energy, you're not going to affect the cell itself.
So let's start a treatment on Ashley, and we're going to talk a little bit more about how this is working, because Ashley, you've had a few treatments so far.
Yes.
And you told me that you couldn't even walk, and now you're feeling much better. We're going to test that off in a second. But while we start this laser, I want you to also talk a little bit about the theory. And we've got to put these glasses on, but you all are actually far enough away you don't have to worry about it.
So what we're going to do is we're actually going to go ahead and put the energy directly into where the nerve is. And once the energy gets in, what happens is the old cells get replaced by new, young, healthy cells. We reduce the inflammation immediately. And believe it or not, there's about 30 to 40% pain relief on one treatment. It's really quite amazing.
You're really stimulating regeneration of that injured area. And I want everyone to know that you use this on other parts of the body as well. This is really, can be used on nerves, tendon injuries, soft tissue injuries. You talked about ankle sprains. Now, you literally have had how many treatments now?
This would be my 3rd.
So how many treatments would it take for the average person to see the effect you're looking for?
Again, it depends on the injury. In an acute injury, we can 2, 3 treatments, they're done. They get effects immediately. If it's a chronic or subacute, if she's got a deep back injury, it may take 10, 12 treatments. But it's pretty amazing. Even people with severe osteoarthritis, we can reduce the inflammation, get rid of the pain, and they can function.
Is it widely available at this point?
At this point, the laser is just starting to expand. American Health Lasers is put together, which is my company. We put together all the protocols, and now we're training doctors across the country. We're actually seeking doctors that are already in sports medicine. We have several teams across the country. We've flown the machine all the way across the country to take care of high-profile athletes. And the results have just been like nothing else. The Clippers, who I work with, they have the present highest powered laser on the U.S. market below this one. and they don't use it. They just call me in because it doesn't do anything. It just heats the surface, and it just doesn't get deep down in. That should be sufficient there.
And so one of the cool things you have is a meter that can test Ashley's ability to deal with pain in that area, and she was tested with this once before.
I'm going to go ahead and push in with the meter, and then Ashley's going to tell me when it starts to hurt. Okay. So she's now at 9.75 pounds of pressure, and when she started, she was at 3 pounds of pressure. So we can safely say, Ashley, you can go back to running. The foot is doing well. At this point, I really don't think she needs another treatment because the tissue has really been restored.
So
integrity.
If you've been given the go-ahead, you want to do a little running for us? A little
Sure.
running in place, some dancing?
Sure, sure.
Let's see it. Do it, because you said you couldn't do this just
so we don't have to fix the other ankle.
Okay.
How's it feel?
Good, great. I mean, I literally couldn't even put pressure on my feet.
So can we get a little...
Sure.
No problem. Fantastic. Thank you, sir, very much for showing us this new technology. Coming up...